I began by asking how the robot works.
So what you can see over my left shoulder on your right is the robot. The top of the robot rises up, the head of the robot. Inside is a xenon lamp. We store a charge in a capacitor from the power from the wall, and then we release that in a microsecond pulse through the bulb. When that happens, you're going to see the bulb start flashing. That is broad spectrum, high intensity UV light. The reason it's been more effective is that all of the mercury light bulb devices are only broadcasting at a single spectrum, low intensity. They glow blue. They look really pretty, but they're not necessarily as effective as what we've been able to prove our robots are.
Are you fully confident that your robot can kill coronavirus?
So we're 100% confident that the robot will kill SARS-CoV-2, which is the coronavirus that causes COVID-19. We ran tests at the Texas Biomedical Research Institute. That's really the largest nonprofit research institute of its kind in the United States. They tested against the SARS-CoV-2 virus. When they did that, we were able to kill it on the surface in 2 minutes, 99.99% decrease in the pathogen, and on N95 masks, 99.994 log reduction in 5 minutes.
And how many people get sick today from going to hospitals when they weren't sick in the first place?
So if you look across the United States, about 2 million Americans get an infection when they go to the hospital, and 274 die. You know, one of the important things to think about in a hospital is the difference between being clean and being disinfected. Something can look really clean, and yet the pathogens are on the surfaces where you can't see them. One of the things that we've been able to prove over the last decade is that when you run a light strike robot in a hospital, by reducing the pathogen load, you end up reducing the infection rates. And we find a very tight correlation. So we have a hospital, it's in Scottsdale, called Honor Health. They treat 92% of their discharge rooms with a light strike robot, and they've seen an 85% infection rate reduction. Similarly, the Mayo Clinic already had a 23% better infection rate than all of their peers. They started using the light strike robot. They dropped their infection rates another 47%.
How much does the robot cost?
So a light strike robot costs just over $100,000. The way the hospitals look at it is, how much does it cost per day? It's about $100 a day. And when you think about a robot getting somewhere between 20 and 60 rooms a day, it's somewhere between $3 and maybe $6 a room.
$100,000 sounds like a lot. How do you justify that cost?
When we look at other industries, we're seeing a huge amount of adoption within hotels, within schools, gymnasiums, office buildings, within government facilities. We've even been disinfecting airplanes, airports, and things like that. Again, because it's so efficient. Now, in the hospitals, we talked about running it for 5 minutes. If we're going after bacteria and viruses like SARS-CoV-2, and this is the only robot that's proven to kill that in an actual lab setting, when you're looking at deploying these, it would be 2 minutes on each side of a bed or each side of a desk, very fast to disinfect a room, have a safe environment for a hotel guest or anybody that's going to their office, a conference room, etc.
What about food processing plants or even meat processing plants?
We've actually used the light strike robots on food to disinfect them. It turns out by pulsing blueberries with 1 pulse, we can extend their shelf life for about 2.5 weeks. So there's a number of amazing properties that come from using the broad spectrum light. You have to limit the amount of power. We went into one nursing home, and at that facility, we were able to wipe out all of the C. diff. They had 14 cases that were ongoing. We got it down to 1 case, and that was a gentleman who refused to be removed from his room. In the course of doing that, we ended up killing a number of plants that were in the guest rooms. They were excited about not having the infections. They were upset about the plants, and we sent over new plants to them. I think that in order to get the economies reopened around the world, people and government officials have to feel confident that they're going to be able to go into public spaces, hotels, airports, airplanes, and hospitals and know that those places are properly disinfected, and they're not going to catch anything by going there.